I have a disease called Graves' disease, and it's an autoimmune disorder, and it's genetic disorder. Not necessarily Graves' disease itself, but thyroid disorders. Usually, if you have one kind of thyroid disorder, someone else in your family will have that same kind or some other kind of thyroid disorder. And both my mother and my sister have a different thyroid disorder. I was diagnosed with Graves in 2004. So it was 9 years ago. It's affected it in different ways based on the different treatments. When I was first diagnosed with Graves' disease, what it is it's when you have Graves' disease, your thyroid is overly active. So all of the mechanisms of your body run faster than they normally would. My heart would beat really fast. I would get very hot. I was full of energy all the time. And I've been, on different medications over the past 9 years and had different treatments that make me feel different depending upon what medications I'm on. So it affects my level of energy, and besides having Graves' disease of the thyroid, since that time I've developed Graves of my eyes and of my skin. So it's affected my vision and the comfort in my eyes, and it also affects my lower legs and my feet as far as swelling, and sometimes there's pain and ability to wear comfortable shoes. Yeah, when I have problems with my eyes, when I first started having problems with my eyes from the Graves' disease, my eyes were very dry, and I would break blood vessels in my eyes. And also, what it is you develop some tissue behind your eyeballs, so it makes it hard to move your eyes around. And just simple things like going to the beach when there's a breeze. I always have to wear sunglasses so there's not as much breeze on my face, on my eyes, so my eyes don't get dry. And as far as the skin, again, it affects my legs. When I was first diagnosed with it in my skin, my doctors have never even seen anybody to have it in their skin, and they weren't sure exactly what was going to happen. So I was told in the very beginning to be careful not to cut my legs or my foot because they weren't sure if it would heal properly. And I've since learned that if I bang myself like normal people will get a bruise, I will get, it's a scar, it's a permanent scar wherever I get a bruise now on my lower legs. Another thing that it affects is my voice. My thyroid, when it's enlarged, it presses against my voice box and it makes my voice come and go, but it seems to make it come and go mostly when I'm in a meeting or sometime when it's really important that I talk loud enough for people to hear me and I can't, or when I'm hollering for you boys to come down for dinner. I can't get my voice very loud. They've done lots of things. The first thing that they had me do was there's a medication that you can take called methimazole. Anyway, it's what it does is it lowers the thyroid level. And when I was first diagnosed with this, the FDA had only approved it to be taken for 1 year because it could adversely affect the kidneys. So when I first started taking it, I took it for about 8 months, and then my thyroid levels were in the normal range, and for about a year I didn't need to take any medication at all, and I felt really great. And then it came back, unfortunately. So what they try to do, other things that they can do to treat an overactive thyroid is radioactive iodine ablation, where they give you a high dose of radioactive iodine, high enough to destroy your thyroid, or you can have it surgically removed. So I had the radioactive iodine, I guess, about 2 years into it, and it didn't work at all, unfortunately, but they do attribute that treatment to the development of the Graves' disease in my eyes and in my skin. So what I've been doing since then, since that time, the FDA has approved the methimazole for indefinite use as long as the kidney function is monitored regularly. So I have my blood work checked about every 3 or 4 months. But now my doctor is doing something kind of interesting that I'm the first patient he's tried this with, and he told me when we first started doing it, it was a more common protocol for this in Europe. But what they do is I'm still taking methimazole to lower my thyroid level, but then they're also giving me medicine called Synthroid that you take when your thyroid level's too low to raise it up, and it's called block and replace. They're using the two medicines, and they adjust them, when needed to make my thyroid level normal, and which it is. Unfortunately, I don't feel great much of the time. I feel like I'm kind of either too high or too low in my thyroid level. We haven't managed to get it just right. So some other treatments, I go to all kinds of doctors for all of the different problems. I go see a special eye doctor who I really like. He's been a very good doctor for me, and he's the one that recommended I have eye surgery because the ultimate cause of having the tissue in back of the eyes is it causes the eyes to bulge, which is what causes all the problems with, eye dryness and not being able to use your eyes properly. And it's also affected my vision. So this past year, I've had 4 surgeries to, first to remove the tissue behind my eye, and then I've had, I guess, 3 surgeries now to try to properly reshape the eye. And hopefully I just had my last one done this week. And my eyes are actually, what I've had done so far has really helped a lot. I can move my eyes, and it's helped my vision a lot. Just to have the eyes work properly has been wonderful. I also see a dermatologist for the the skin disorder, and quite frankly, he has no idea what to do with me, and he prescribes different medications, and sometimes they help and sometimes they don't. And most recently, my primary care doctor had recommended that I go to physical therapy to try to help, with some of the mobility in my feet and my lower legs, and to reduce the swelling. And those are some of the treatments that my doctors recommended. Well, they don't really know what causes it, but they do think it's genetic. And my doctors have also told me that stress might contribute to it. Also, my age. Most people diagnosed with thyroid disorder are women in their 40s and 50s, and I was in my early 40s at the time. Also, the radioactive iodine treatment that I had, because I was a cigarette smoker, may have caused the problems with my eyes. They're not sure if that contributes to that, but it could.